Now, CBT, of course, has a goal, and the goal is to help our clients feel better. And when we say we want to make our clients feel better, it looks at three aspects. One is feelings, two is cognitions, or as we call it, thoughts, and three is behaviors. Now, often clients who will come to you, they are pretty aware that their feelings, like how they feel, is affecting one, their thoughts, and it is also affecting their behavior. So this is something which is more evident, I could say. Most of them are aware, like, I'm not feeling good today, so I did not feel like exercising. This is how they will put it across to you. But what they are not aware of is the fact that it is their thoughts, it is the cognition which is actually affecting how they are feeling. And it is also their thoughts which is resulting in a particular behavior, or maybe it is resulting in avoidant behavior. Okay, so this is something which they are not aware of. Also, what they are not aware of, and I'll talk about this. Let's first talk about this. Like, why are they are not aware of is the fact that how behaviors are also affecting one, how they feel and how they think. Now, say, let me take the same example. Okay, this person who says that I was feeling bad and so I did not work out today. But still, if this person now decides to, if I am feeling low, I don't feel good, but still I'm going to push myself to come out of the bed and go and work out. If this person does this action, what is going to happen? Immediately, the endorphins are going to rise, the cortisol level will reduce, and what will happen when this happens? Immediately, the feeling becomes, you start feeling good. That is how endorphins are called as, the feel-good hormones. And at the same time, it can also make them think that, wow, I was able to do this. They might start feeling confident about themselves. So this is a small little example to understand how it is not just your thoughts, but it is also your behaviors that can have an impact on how you feel and your thought. Now, let me come to the point which I was trying to make. Lately, because CBT is making a lot of rounds across social media. I see a lot of these posts and workshops and a lot of people talking about CBT. I also have noticed this, that they are mostly concentrating on the thought aspect, like, how thoughts are affecting your feelings and your behaviors. And a lot of times the other part of it, because we're talking about CBT now, so there is the behavioral aspect is there. We need to understand that it is also our behaviors which are affecting our feelings, and it is affecting how we are thinking in a given situation. However, what happens is when a client comes to us, they would first want us to work on their feelings. But as a therapist, where our role comes into places, we need to explain them. Although it is not impossible to change the way you're feeling, but it is definitely difficult and it is definitely challenging. So a better way to go about it would be by working on your thoughts and working on your behaviors. And when you explain this, you will also realize that, behaviors are not always the function of your feelings. All right. So it is not that it is like always your feelings will govern your behaviors. It can also be the other way around, where with your behaviors, you can bring a change in how you're feeling. Now, this logic might not fit right or correctly in a client who has been diagnosed with depression. Okay, you need to understand that this might not really work for them. They might take much more of efforts to push themselves out. But this is something what we at our levels can do. If we are not undergoing treatment for depression, it is we can definitely work on this. So something where this works beautifully is procrastination. So if there's something we have been procrastinating over, like बाद में करेंगे, we are watching Netflix, हाँ ये series के बाद करेंगे, इसके next episode के बाद करेंगे, and what happens now? You end up spending many hours watching, binge watching, and then later you start feeling bad that, oh, I did not do it. In the same way, yeah, Ananya has a question there. Yes, Ananya, come up with your question. So That is how behaviors are not always the function of feelings. It can also be the other way around. Okay, so by behaviors you can change how you're feeling. I was trying to say that it is not just the feelings that affect your behaviors, but also the other way around. With your behaviors, you can bring a change in your affective state. That is how you're feeling in a given situation. Dr. Shelley has a question here for me. Let me just take it. Ma'am, as you said, it might not work with depression patients, but is there any chance it can work at any stage of depression? Dr. Shelley, yes, let me just bring a clarity here. What I'm trying to say is we might take more efforts to make it work for a client or a patient who has been diagnosed with depression, because as we know, there's a complete chemical imbalance when we talk about a patient who has been diagnosed with clinical depression. And so trying to push themselves out from the bed to do something which they have always loved doing before stepping into this phase of depression, it might, even that small little thing can be difficult, like just going and taking bath for that matter can be a very difficult task for them, right? Of course we can do a lot of things with patients diagnosed with depression, and CBT somewhere, CBT, the origin in itself came up when Beck was working with depressive patients. So there's a lot to discuss about CBT and depression. I would really request if you could hold on to that question till we move on to tomorrow, because there we will be discussing in depth how to work with a patient who has been diagnosed. So there I'll be talking about different aspects of depression, how we use it, and also I'll give some tools to each one of you which you could use with your clients, right? So I would just request you to hold on to that till tomorrow. So I hope this model is understood well, because this is like the base, okay, of CBT. You need to understand these three things: feelings, thoughts, and behaviors, and how these three interact together. And it is not just the feelings affecting thoughts and behaviors, it is also the thoughts affecting feelings, behaviors, and behaviors affecting thoughts and feelings. This is where it becomes CBT approach. All right. Now, when when your client comes to you, most of the time, they of course they will be coming up with certain issue, and as a therapist, your role is to find out where can you bring in an intervention. Okay, what I mean to say here is you have to figure out first, is it at the thought level or is it at the behavioral level? Okay, because now that we have understood, it is also the thoughts and it is also the behaviors which have an impact on how they're feeling. So if we want to bring a shift, if we want to bring a change in their feelings, we can be working on thoughts and we can also be working on behaviors. As a therapist, you have to find out where can you use the intervention. Like, do you want to work on the thoughts first, or is it with behavior, or how the combination can work? Now this will completely depend on, one, your expertise, as a therapist, how you progress in this journey of being a therapist. That is one. And also with then you will be able to understand the client and you will understand where can you bring this. When we talk about bringing an intervention, which can either be at thought level or it could be at behavioral level, why are we trying to understand these two? And when do we try to bring intervention? Like in the first slide I have mentioned, when either of them are unhelpful. So if they're indulging in thoughts which are unhelpful, as in which are not valid, or behaviors which are unhelpful. So let's first talk about behaviors and then I will move to thoughts.